Now at the second part of our conversation, again, we're going to go back to our spine, and we're going to talk about the 3 techniques that, as I earlier mentioned, to help you with the lumbar disc, with your lower back pain. One thing I'd like to bring it up to your attention that if you have a problem with the lower back, such as disc herniation, as you see here, the disc is being herniated, the lower back muscles where my hands are on both sides, they're going to be very spastic and very tight. People that are suffering from the back pain, they know how painful it is, and it's extremely tight. Now, the reason for that is basically the body's self-defense mechanism to begin with, because it prevents itself from further injuries, things that another injury is going to happen again. So in order to prevent himself or herself from the future injuries, it's trying to protect itself, right? Now we want to relax this muscle, okay? Because as long as it is spastic, it's not going to let this disc to heal, to go back to where it is. So in order to relax it, in the front, you have abdominal muscle, okay? Rectus abdominis. And then in the back here, you have gluteus muscle or buttock muscle. So what we should do is, we should strengthen the lower abdominal muscles here, also the buttock, the gluteus muscles. Because if these 2 muscles are strong, this muscle, lower back, is going to relax and is going to respond well to the therapy. But if the gluteus muscle and the lower abdominal muscles are weak, this is not going to relax. And you can go as much therapy, get as much therapies, but it's going to be very difficult to relax these muscles, okay? So I'm going to show you this exercise that you can strengthen both the gluteus muscles and the lower abdominal muscles, okay? And also will help you to push this disc to where it came from, okay? So for that, let me demonstrate. It's very simple. What you're going to do here is you're going to lay on your back, face up, okay? So it's going to be like this. And what I do here is, I'm going to start with the left leg. What I do, first I bring the knee close to chest. Now my hands can be in any position, it doesn't matter. And I extend the leg as much as I can. I push with this heel down and bringing the toes on the left hand side close to the ceiling. And I hold it to maybe 30 seconds, depending how much you can. You can go up to 1 minute if you can, okay? And you're gonna go close to the ceiling as much as you can. As I'm doing this, I'm using my gluteus muscle and my lower back muscles. So I'm making it stronger, and I'm pushing the disc back to where it came from. And I'm gonna lower it down. And it's extremely important when you lower it down, you put down your hip very slowly, okay? Kind of like crystal plate. Don't drop it once. The other side, first you're gonna bring the knee close to chest, extend it like this, and then go up. And as you see, I'm pushing with this heel down and bringing the toes closer to ceiling. And I'm gonna hold it for like 30 seconds or more, and then gonna lower it down slowly, and then put the feet down. This is one of the most important exercises that you will do to treat your disc. The second one, I'm going to show you McKenzie exercises, okay? So for that, we're going to need our timer. I'm going to use my timer here. I use it, my phone, for 1 minute, okay? I'm going to sit here for 1 minute. And what I do is I lay on my stomach, face up, my elbows goes right under my shoulder, and I set it for 1 full minute. And I'm holding this position for 1 full minute, chin up. And what I'm doing is, besides stretching my abdominal muscles, my stomach muscles, I'm also helping the disc to go back to where it came from, push it back. You're gonna hold it for 1 full minute, like this. And if you want to make it a little more effective, you can also bring your knees close to your buttock, which then you're going to feel more extension. You're going to hold it for a full minute. And then when the minute is up, after 1 full minute, assuming that you did, you're just going to lay straight down like this, flat, for 10 seconds. So 1 full minute, like that. So 1 full minute followed by 10 seconds stretch, relaxation. So now how many times you're going to do it? You can do up to, I would say, 7 times for 7 full minutes. And the ones on the back, those exercises, to keep it basically simple so you won't forget, do it 4 times. Do it 4 times, each time in the morning or evening, doesn't matter. The other technique that I'm going to show you is the extension technique, that you have a towel that is rolled like this to create extension, okay? Sometimes our patients, we use foams or anything that's going to give extension for the lower back. And the way we do it, where I have pain, I'm just going to put right here in the lower back curve, and very simple, I'm just going to lay right over it, just like this, and just leave it there for 7 minutes. And after 7 minutes, slowly you can come out. Again, depending your comfort level, you can use a foam or roll towel. And if anything that makes you uncomfortable, if it hurts, use your common sense, just simply stop it. So all this that I showed you, see how it feels. Not everything works for everybody. You have to understand that. So if something doesn't feel good, very simple, use common sense and don't do it.